Hi, it's me again. Ian, Keith, Dad, Grandad. It's early hours, so I'm sat here in my lounge, dark outside. Not sure quite how long this is going to take, so I might end up doing this in a couple of videos. Tips and tricks. Okay. Right, where do I start? You've got to do your homework. And doing your homework, you've got to be very careful how you do it in terms of online. If you watch a lot of the American stuff, you've got to remember this, that they're based around money. Excuse me. So very often you'll see these things and they're advising that you do this, and then at the end they'll try and get you to buy something. Use our procedure, it's the best in the world, that sort of thing. So avoid those. Best place I've found to go to is Cancer Research UK, or CR UK. You see it advertised on TV. Very good. And of course NHS website, theirs is good also, but not quite as detailed as CR UK. CR UK is excellent, very thorough. Yeah, so that's in terms of information. You got to remember is that it's incumbent on you to make decisions about your health and what procedures are going to happen in the future. So you're going to be getting specialists and doctors saying, there are these options, what do you want to do? So you need to, they'll obviously give you the best advice and try, you can ask questions and they'll try and tell you what's right. But, find it out. It takes time, a lot of information coming at you. So, if necessary, get a notepad, write it down. So, that's in terms of handling the disease. Lots of different decisions you'll have to make. That's what suits you best. You might decide not to have anything. That is an option. Obviously, it might shorten your life, but, that's up to you. Right, let's take the clock back quite a bit in terms of, you're starting to get this situation where you're peeing a lot, or you're having to go to the toilet a lot more for a pee. So what you start to do naturally is that you start to reduce your fluid intake. Now, get a bit of paper and pencil or pen, and you might want to write these down. The normal fluid intake for a male, daily intake, is, and that could be my memory, but it's about 3 litres, 6 pints. That's the cuckoo clock. 6 pints. So get yourself a pint glass or a pint bottle, half litre, and count them as you drink. Bear in mind, if you have a cup of tea or coffee or orange juice or pop or whatever, they all go towards the fluids, or milk, So get yourself a measuring jug and get your normal glass or your normal cup, fill up your water out the tap and pour it into the jug and see how much volume it is. Because you need to manage your fluid intake, because you will naturally be trying to dehydrate yourself, reducing fluid intake so you don't have to visit the bloody toilet so much. Don't do it. Try and keep your fluid intake up. I'm terrible at this, but there we go. And Verity was very good, because what she explained, the nurse, when I was having the biopsy, she said if you keep your fluid intake low, your urine strength increases, and your bladder and your prostate doesn't like strong urine. You'll know when your urine's getting strong because it'll smell, it'll start to go yellow. It should be almost clear with a very slight tinge of yellow. And then you'll know that you're on the right intake. So that's crucial. Just to explain, I mean, I'm suffering all this pain and, I'm burning and stinging when I'm urinating. But with AF, and I went into AF last night for an hour. And of course, I've told you before, what starts to happen is you start to pee for England. Literally every 5 minutes, I'm filling my bladder. So what I've found, and this is most interesting, is that when I'm in AF and peeing like crazy, very quickly that burning and stinging subsides, and I'm peeing a lot better. My flow's a lot stronger, not excessive, and I'll come on to that in a bit. So she's right, it does help. I mean, if you can bang out the fluid, pain and whatever will diminish a bit. And hopefully it works for you. Right, so where was I? Yeah, fluid intake, fluid monitoring. The other thing to do is, if you remember in your school days when you were doing your science lessons and you were in the lab or, the classroom with all the Bunsen burners and things, you have these plastic, or in those days it might have been glass, measuring tubes, which are scaled in millilitres. You need one of those. Now, the one I bought, you can get them off Amazon, eBay, wherever. Laboratory supplies. Get yourself a 250 millilitre capacity. Plastic, so that you don't smash them, whatever. Because you're going to be needing to measure your urination. The normal intake is, as I said, 3 litres. Now, normal male bladder size, maximum capacity, ranges between 300 millilitres and 500 millilitres. So in theory, if you pee normally and you get a full bladder, you should go to the toilet and pee at least 250, maybe a bit more. If you've got a big bladder, you'll fill that measuring tube twice. By the way, they cost about, 9-10 quid, something like that. The other thing I found very helpful in terms of purchasing is buy one of these urination bottles with a screw top. They work for women as well as men. You get them on Amazon, and it's a bit like these, like in hospital for men, you get these bedpan bottles that you can pee in, and in hospitals they're made out of cardboard, but you can buy plastic ones. Useful if you get took short in the car and there isn't services nearby, because I'm telling you now, your prostate's going to be giving you hell, or your bladder is. For instance, day before yesterday I went to the GP's, and it's 10 mile into Penzance. I peed before I left, 10-minute drive. By the time I got to the GP's, I was desperate. Straight into the toilet as soon as I got there, peed, sat down, waiting room. Half an hour went by, I'm beginning to get the urge, went on another pee. Waited a bit longer, thought I've got to go again. Had another pee. Luckily the doctor hadn't come out. Called me in the surgery, had my consultation, went out. First thing I did, pee again. Left the surgery, got in the car, went home. By the time I got home, and I'm desperate again, literally running to the toilet. They call it urgency. So you need to get yourself something to, if you're on a long journey, you're going to be in trouble. yeah, practicalities, tips and tricks. I'll explain about the measuring tube in a minute. The other thing is that where we live it's very dark, there's no street lights or anything because it's rural. I bought a set, 3 motion sensing battery powered LED lights, night lights, and they've got 4 batteries inside. They're not very big, about 4 inches square. Excellent. And of course you're going to be getting up during the night. One thing you don't want to be doing is turning the lights on, disturbing your partner. Position 1 in the bedroom, 1 in the bathroom. Don't need to put any lights on. You can basically go, keep swinging your arm, keep turning it on for the motion sensing. They go on for about 30 seconds and then turn off again. So the batteries last a couple of months, maybe 3 months. Very useful. And I'm sure there's something else I forgot, but it'll come to me in a bit. Right. The thing that's going to happen is that because you're dehydrating yourself, urine's going to get a little bit stronger, potentially. And of course it'll smell. So personal hygiene. You need to be making sure that you're clean. When I pee, what I start to find was that when I finished, and of course men normally shake it and get the drips off at the end, it stops working like that, don't work anymore. So I found that, I was tucking myself away and coming out, and then I was thinking, I feel a little bit damp, and I'd get a few drops that would then go onto my pants or my pyjamas or whatever. And of course then you notice that it's potentially smelling. And if you've got a dog, he'll come up and smell and nuzzle you in your crotch. So he'll tell you you're smelling a bit. Anyway, so what I've found now is that when I have a pee, I take a sheet of toilet paper, scrunch it up so it's in a little ball, and then dry myself. But before I do that, I squeeze my penis a bit like a toothpaste tube, getting the last bits out. Excuse me. And I start right down as far at the base as possible, and then obviously work the tube up to the end so that any remnants come out. And it works. I've found that I'm a lot drier now. And of course I dab the end, because if the urine gets under the foreskin, which it naturally will try to, it then sits there and it festers, and of course it then begins to stink. So I find that quite regularly I'm sort of washing myself. So if you've got a bidet, excellent. If not, then, find your own means. But make sure you're clean, because obviously you'll start to smell. So that's one practicality. Right, the other thing is that in terms of drinking this 3 litres of water, you don't want to be doing it during the night. So what I tend to do is that I drink as much as possible while I'm up during the day. And then about 6 o'clock-ish, something like that, I stop drinking. I don't have a beer or anything like that, or a cup of tea. I do occasionally if I really sort of fancy it. And then obviously I have a pee before I go to bed, which is sensible. And then I find that every 2 hours on the dot, 12 o'clock, 2 o'clock, 4 o'clock, and that's what's happened. I'm 4 o'clock this morning, 4:30, I can't get back to sleep. I've come and sat in here and recording this. So after 6 o'clock, don't drink. When you get up for a pee, you'll be getting a bit dry, and if you're feeling dry in the mouth, you are dehydrating. They reckon that if you've got a thirst, you're already dehydrated. So you shouldn't be getting the dry mouths. And that's another indicator of dehydration. So what I tend to do is have a just a very small sip of water every time I have a pee. Just a tiny bit, just to wet the mouth and, make me more comfortable. Go back to bed, try and get another couple of hours. The other thing, and I'm finding this now because obviously I'm in the stages of, I've got a cancer and, managing it and whatever, and I've got the severe burning and stinging. I found now that I'm tending to take a 500 milligram paracetamol during the day, and that eases that burning and stinging just a little bit. Still get pain, but not quite as bad. But the other thing, and I've been doing this for a year or two, and I wouldn't recommend you do this every night. I've tried nitols and all these sort of herbal things. Don't keep me asleep. I'm still getting up for a pee. But one paracetamol, 500 milligram, as I go to bed. Obviously, it starts working within an hour. And sometimes I find that I've slept for like 4 hours and I've missed me 12 o'clock and then I get up at 2 o'clock. So, I get a good 4 hours kip. And I've even sometimes I've sort of got up at 12 o'clock and thought, oh, bugger. And so I take a paracetamol then. And occasionally I've slept 6 hours. And not very often now. But, brilliant, bit of sleep. Because that's, it's sleep deprivation you get with this. As I'm sure you know. Excuse me. I'm a bit clogged up. Medication, side effects. For my heart. Anyway. I should blow my nose, really. Yeah, so paracetamol. Now, be careful. Don't cocodamol, which doctors tend to issue. And if you notice, it'll say 8,500, 15,500 or 3,500. The 500 is paracetamol, which is great, no side effects. But the 8, 15, 30 or whatever, that is an opiate-based medication. So it's a bit like morphine or heroin. It's not heroin, but it's addictive. So if you've got cocodamols, don't use them. And I was thinking, it's a bit like Michael Jackson. If you think Michael Jackson, when he used to grab his crotch and go, oh! That's because he's got prostate pain. That's why he ended up bloody addicted to drugs. And end up doctors administering him and killing him. But there we go. I digress again. Yeah, so stay off the cocodamols because they give you constipation and all the rest, and addictive. And so, you'll think, well, this is great, they're working better than the paracetamols, but don't do it. Yeah, right. So that's, I think that's, in terms of what you find is that your partner, wife, husband or whatever, will start to tell you, and your pee's smelling, because the toilet smells, because you go in that regularly, you're not flushing as often, which you should do, I guess, because you're only doing little bits. So you've got this measuring tube, and at some point you'll be going to your GP and saying, I'm not peeing a great deal and I'm getting pain or whatever. I'm getting up a lot during the night. And it's handy if you can say to him, I'm peeing this much. So, what I do is that piece of paper and pen by the toilet, measuring tube by the toilet, and you can do it for 24 hours, you can do it for 2 or 3 days, you can do it for a week, it's entirely up to you. But it's a bit of a science lesson, a bit of a science class, homework. So, what you do is that you, obviously, when you go to the toilet, you pee into the tube. You log it down on the sheet of paper with your pen afterwards, and those measuring tubes are excellent, very accurate. And you do it to the milliliter. So you might have like 112 millilitres, whatever. And they're done in sort of 5 millilitre scales, so you can judge roughly where you're at. Mark it down, mark the time, do it for 24 hours, through the night as well. So that little sort of night light will help you see without putting the light on. You can obviously rinse it, pour it down the toilet afterwards, and rinse, put some water in the tap. And give it a clean out, and then use it the next time. Once you finish your 24 hours, you'll find, get your calculator, type it all in, add them all up together, all your millilitres. Once you get to 1,000, that's a litre. That will tell you how much you're expelling in terms of fluid, and you should be expelling more or less what you're taking in. I did it the other day. I got 1.1 litres in 24 hours. I was severely dehydrating myself. So I've, physically, you have to force yourself to drink the water because you've trained yourself not to drink. So, yeah, 1.1 litres in 24 hours, nowhere near enough. It should have been 2.5, possibly. Right, the other thing to do then is that once you get your total, divide it by the number of events, number of times you went to the toilet. So I think it was just over 1.1 litres, or just under, 1.1 litres. And I've been to the toilet 12 times, which is like every 2 hours. And if you divide 1.1 litres, 1,100, by 12, you get, I think my actual worked out to 83 millilitres. Now, when you consider that your bladder is at least 300, if not 500 millilitres, so I'm only expelling 80 millilitres on average, which means that I've still got something like 220 or 420 millilitres left in my bladder. And that tells you you're not emptying your bladder. Tells the doctor you're not emptying your bladder. Your flow rate, 83, that's nowhere near enough. As I said, it should be near to 300, near to 500. Right, the next test, get your mobile phone, put it on the clock, set it to a stopwatch. And you only have to do this once. Make sure you've got your measuring tube, go to the loo, set your phone on top at loo, don't drop it down the loo. Get ready with your stopwatch, get your measuring tube, bit of a juggle. Obviously put your phone on top at cistern so you don't have to hold it, you won't have enough hands. As soon as you start peeing, hit the start. And, go for your pee and wait until it diminishes and you're getting, don't wait too long, just until the stream stops or gets almost to nothing. If not nothing, hit the stop and get the time. I did it the other day. I managed 90 millilitres and it was exactly 60 seconds. You divide the 90 by 60 and it comes up with 1.5 millilitres per second. This is where you need your piece of paper and pencil, you see. So 1.5 millilitres per second, if you Google it, what is the normal flow rate of male urine? And it will tell you that a male urination is normally between 10 millilitres per second and 30. I wish. I wish. Good God. I'd pee over the school wall again if I got that. Yeah, so again, you can get that information, go and see your doctor, your GP, and say, I'm only peeing 1.5 millilitres per second and I'm doing 80 millilitres every visit and I'm peeing 24 times or 12 times in the 24 hours. Every 2 hours I'm having to get up, So, and you can even set the maximum I achieved was 100 odd millilitres. The minimum I achieved is 60, which is what I was sort of doing, my figures. Right, so we're up to 25 minutes now. So I think I'm going to stop this and then I'm going to start another bit, which is talking about the prostate cancer in terms of, statistics and data. And I think I've covered most of the sort of tips and tricks. Oh, yes. The other thing is that give yourself some quietness when you're doing it. I'm trying to think of the right word, but when you go to the services, don't stand at the urinal with everybody else around you. Always go into a cubicle because you're going to have difficulty peeing. It's embarrassing. Shut the door and don't rush it. Just take your time. Don't try and force it out because you're not going to do yourself any good. It's not going to come out any quicker. And just relax. You'll find that by relaxing, you get the best flow and it will last longer and you'll empty your bladder more. You go into the cubicle, you stand there, and of course, if you've been driving and you've been desperate, if you don't empty your bladder when you get the urges and you're hanging on to it in the vehicle driving, waiting for the next services in 30 miles, you're in difficulty. And by the time you get to services and you go into cubicle, you stood there, you're moaning and groaning and howling and effectively only drips are coming out and then very slowly it'll pick up and then you'll get a little bit and trickle coming out, And the guy sat next door in the cubicle's thinking, Jesus Christ, is shit in a brick. And the other thing that you find then, when you've at the services, and I've done this, and you've eventually stopped, you've not released a great deal, and you feel like you still want to go, but you can't. Don't panic. Come out the cubicle, wash your hands. Go and have a walk round, and literally within 5 minutes, you'll be going back in again. Go back into the cubicle, and this time you find that the flow will be better. Then go and have a cuppa, smallest volume possible, hopefully, for your journey. And make sure that before you go out to your car again, go a third time. Make sure your bladder's empty before you set off. Plan your journeys. I find I know where all supermarkets are because you can pull up in their car park and go and use their toilet. And there's no joke somewhere. I can't remember all the full details, but it was never pass up an opportunity to pee. Very true. Don't pass up, even when you think, oh no, I don't really want to go. Before you set off, empty your bladder. Anyway, tips and tricks, over with. I can't think of anything else at the minute. The next one, I'll talk about the statistics, cancer statistics, and things I've learnt. Maybe accurate, maybe slightly, tainted with. But I've read Cancer Research UK. Anyway, it's just cracking dawn now. I'm guessing it's about 6:30, something like that. See you all again. Don't forget, subscribe, like, comment, all the usual things. 30 minutes up. Speak to you again shortly.